Hi, my name is Dr. Ron Guberman. I am the director of the Podiatry Residency Program at Wyckoff Heights Medical Center in Brooklyn, New York. I mean, we see pretty much the full gamut of wounds, and we see a lot of wounds. Our wound patients range from, the diabetic wounds, venous wounds, traumatic wounds, ischemic ulcers. We even see things like sickle cell and other disease-related ulcers from vasculitis of various conditions. Pretty much the full gamut of all types of wounds you might expect. Post-operative wounds, wounds related to post-cancer treatments, radiation treatment, all types of things. We have a very large Spanish-speaking population from all over, mainly, Caribbean, Central and South America. We have a very high percentage of diabetic patients, very large diabetic population. We have, from the young to the old, we have some very elderly patients, and we have, unfortunately, some very young diabetic patients as well, and everything in the middle. So it's a pretty widespread type of demographic in that regard. Well, the challenges are that we have a lot of complex wounds. We have a lot of people that don't come and seek appropriate medical care when it's necessary. We have a lot of people who don't take care of themselves properly. That you might call it a compliance issue, or you might call it just an issue of lack of support from the community or family, enabling them to get that proper care. So it's a combination of all those things. People sometimes have a lot of comorbidities as well. That's another issue we see. With the diabetic patients, many of them have renal problems, cardiac problems, and other issues that and of course vascular problems that make their treatments and their conditions very, very difficult to treat. Obesity is another big one. Smoking is another big one. So these are very complicating factors. TWO2 has been a mainstay of my practice for the last several years. I had used topical oxygen in the past, and I had really not been extremely happy with it, but the new generation, this TWO2 is a far superior delivery agent. It's not that, it's sad to say that people think that oxygen treatment is not a good treatment when we know how necessary oxygen is for wound healing and for survival of the organism and the cell in general. It was really the older delivery systems that were the flaw, and I think people are still hung up on that. This TWO2 system is, to me, the most superior system. It provides a gradient of oxygen in a pressure gradient, so it allows for deeper penetration of the oxygen, and that's proven through research. There's quite a few randomized controlled studies, some really extensive ones, that show over and over again that not only does the oxygen get to the tissue, it stays in the tissue, and it stays there at very high rates. And this we know will aid in fighting infection, it aids in neovascularization, it brings in many wound factors that are necessary for wound healing, and other things, many, many other things that oxygen, which is the most necessary thing that you need for cellular life and metabolism, the presence of that or the lack of that can determine whether your wound will heal or not. So for me, this has been a mainstay now in my practice, and I've seen excellent results across the board on a variety of wounds, all types of wounds. I can't say there's a wound where this won't help. Any wound that needs any assistance or that you want to heal faster or better, you actually get superior wound healing with this therapy, because the cross-linking in the collagen, the organization of the skin, and the durability of that healing is far superior to what you'll even get from normal wound healing. So there are many, many advantages. Lack of recurrence has also been shown to be highly acknowledged in many of the randomized controlled studies that have studied that. So there hasn't been one that hasn't shown it when it's been tested. So that is a huge thing to me, because you not only want to heal the ulcer, you want to maintain it. So this is helping you do that as well. It's healing it faster, it's healing it better, and it's maintaining it. From a very pragmatic standpoint, the use and delivery of this system is also a great advantage. most things like the negative pressure require a visiting nurse to come to the home, can involve, painful and expensive bandage changes and things of that nature. These things have to be arranged for home therapy because many of these patients have these chronic wounds that require them to be treated at home and come back to the clinic. And this could go on for, as we know, months. With this system, I can put on a bandage that could last for a week. The bandage does not have to be removed at home. This therapy, the boot that it comes with, goes over the bandage. You don't have to remove the bandage, so it's painless as well, which we know with negative pressure and other wound care issues, they're messy and painful. So we can deal with that in the clinic, and we can observe the wound every time and take care of it properly. The patient's satisfaction and compliance with this is extremely high. This was one of the other things that sort of pushed me to want to use this system is, as I started to use it, I found out that the patients, when they came in, they were so happy with this versus any other type of treatment they had. It gave them a lot of freedom because it only has to be done for, maybe an hour a day, and not even every single day. 5 days a week is plenty. And they have the freedom to roam around. They don't have to wait for a nurse. They don't have to go through painful changes. They don't have to be concerned and walk around with a negative pressure device 24/7 and be worried that that thing's going to stop. The doctors don't have to worry about the patient being compliant with a negative pressure type device or with the visiting nurse situation, whether they're going to show up and the patient's going to be there, or what's going to happen to that wound in between. So it offers so many advantages, and the patients themselves are very, very happy with it. They also report a reduction in pain, which has also been studied through these research trials, the randomized controlled trials. And that reduction in pain is notable, and it's obviously another plus. We've had a lot of excellent results in cases in all types of ulcers, both in venous, arterial, ischemic, diabetic ulcers, sickle cell cases, all types of cases, of course, traumatic and, other wounds. The results have been really excellent. We have a lot of very satisfied customers and doctors, too. Patients who have been treated in the community that have had long-standing ulcers with a variety of treatments. We've been able to heal a good number of these patients with this therapy. And that's been a very, very positive, thing for everyone in the clinic and for our patients especially and their families. Well, TWO2, again, you have to look at some of the other systems, and they don't offer all of the things that TWO2 offers. There are other oxygen delivery systems, and I don't think they're as good for quite a few reasons. From a technical standpoint, they don't offer the pressure gradient and the high levels of oxygen into the tissue. That's number one to me. And this system is definitely, to me, from what I've read and from the research that's been done, the type of research that's been done on this particular therapy is also superior. And it's proven that this type of therapy works versus the other therapies, which don't have that research support, that significant research type support with really good studies, randomized controlled trials that are significant and show the benefits of it. So I have no issue recommending this. There's really, really very little downside. The company itself takes great pride and care in providing excellent support and help to the patients in their home so that people are comfortable with what they're doing and how they're doing it. And they're very reliable, and they're always available to assist you. So there's no aggravation on that end. I would highly recommend this to any doctor or patient who has a wound and needs assistance with healing that wound in any way, shape, or form. This is a highly successful device that's very well tolerated and works extremely well. So I would highly recommend it and suggest it to anyone. There's no reason not to. It's a no-brainer. It's helpful, and it's not harmful. And for that reason, I don't see why you wouldn't want to try it.